Okay, I'm going to slowly get us started as people start to come back into this session.
Okay.
So, just looking at our time here. Okay. Welcome back, everyone. I hope that you enjoyed the brief break and the wonderful remarks that we heard on behalf of the ambassador. In this session now, we will be discussing how to scale and integrate WorldGBC's Global Health and Wellbeing Framework principles to the community and the city level. So for this, I welcome our moderator, Hamoda Youssef. Hamoda is the Head of Technical Affairs and Sustainability at the Qatar Green Building Council. Hamoda coordinates sustainability integration efforts for a variety of projects, sustainably oriented initiatives, programs, and building codes. As a WELL and lead faculty and accredited professional, he facilitates sustainability training and provides sustainability assessment and consulting. Additionally, Hamoda is the national operator and coordinator for the Greek Key and Eco Schools program in Qatar. Prior to joining QatarGBC, Hamoda worked as a senior sustainability consultant, managing site-wide lead consultancy services for a mixed-use development in Doha, Qatar, as well as working on environmental urban development projects in Italy and the US. Hamoda, thank you for joining us. The floor is all yours.
Thank you, Dominica, and thanks everyone for joining us today. It has been really interesting sessions so far, moving from one panel to the other, and the speakers and excitement going there. Lots to learn and lots to take back. I hope the session will follow the same suit and with our excellent and experts joining us today. So the session today will look at scaling up the health and well-being principles to a city level. For those that are joining us for the first time, I highly recommend that you check the World Green Building Council Health and Wellbeing Framework that was launched November last year. In that framework, a group of experts, and I was honored to be part of them, we looked at establishing a framework for the health and well-being principles. And one of the early discussions we had was looking into the scope and the scale. The agreement back then to have a stage one start focusing on the building scale, given that we need more time to look at the bigger scale from a city and neighborhood principles and factors. With that said, the framework concluded or was framed around the 6 principles: protecting health, to prioritizing comfort, harmony with nature, facilitating healthy behavior, creating social values, and taking climate action. We all understand and see the importance of combining or looking from the same lens into the planet and people health. So it's one health in the end. It's not either or. With that said, I'm happy to introduce our group of experts today that will take us further of how this can be scaled up from their expertise and knowledge. So we have with us Pascal Eveillard, the Director for Sustainable Business Development in Saint-Gobain. Welcome, Pascal. And Jessica Verdon, the Senior Social Sustainability Manager in Multiplex. Hi, Jessie. And Nathalie Lohr, the Head of Urban Health in World Health Organization, WHO. Hi, Nathalie. So let's get started with our first question, and that will be from Nathalie and the WHO perspective. So we have, we know that several programs that has been evolving over the years, especially looking at healthy cities and healthy housing, and it's going beyond the typical, I would say, expectation of finding a cure or showing any of these. So first question to you, why is WHO highlighting the importance of these areas for health, speaking of urban scale level?
Thanks a lot, and thanks a lot for giving me the opportunity of being with you today. Please allow me maybe to start with some background remarks just to set the scene. Urbanization is certainly one of the leading global trends of the 21st century. I think this is not anything new to any of us, and it's having significant impact on our health. We know that 55% of the world's population will live in urban areas. and the proportion is expected to increase actually to 68 by 2050. And yet most of the 4.2 billion people who live in cities, so we're actually speaking about half of humanity, they do still suffer from exposure to pollution, occupation and road traffic risks, but also lack of food, safe streets, and certainly also amenities like green spaces. And certainly these challenges do make cities as epicenters of the non-communicable diseases epidemic that we are facing today, and also drivers of climate change. So urban areas are really the hotspots for the translation of the social and environmental inequalities into health inequities, with 1/3 of the population in urban areas living actually in slums. And as the most of the future will be in cities, there is a unique opportunity to guide urbanization, to include health, and to promote equity. So all this makes that WHO has been emphasizing the work on urban health in order to support countries and cities to strengthen action at a local level, and in collaboration with many partners, and certainly with a variety of entry points and resources. For example, spanning from developing capacity building or to provide very specific normative health guidance for sectoral interventions or doing urban health equity assessments. And one also entry point is the creation of city networks. The Healthy City Network, so that's what you referred to in the question, is actually a global movement, and it's one of the approaches to address health at the urban level. And it engages local governments in health development through, a variety of political commitments, institutional change, etc. And actually, the Healthy Cities is one of the networks. Now, moving to housing, in the context of urban development and urbanization, housing plays a crucial role. Housing is becoming increasingly important to health in light of urban development, aging population, and climate change. And we know that there will be an increased demand for housing. And at the same time, we know that improved housing conditions can save life, prevent diseases, and also increase quality of life. So we know that people with lower socioeconomic status, for example, they are much more likely to suffer from energy poverty and tenure insecurity, also to living in overcrowding or in housing with indoor heat or cold. So all these health risks have an impact on health. And that's why WHO has been steadily increasing the work on housing as a major entry point for primary prevention and to promote health. So this is, one of the key ways to address social determinants of health at the local level. I'll just maybe stop here.
No, yeah, I mean, we'll get back to we have several questions, and looking at the region, we are seeing an up demand for the Healthy Cities Network, and several regional cities in different of our regional countries are getting in the system and getting fulfilling the joining requirements. So now let's scaling up the scope, as you, Nathalie, mentioned, for the health and well-being, from building scale, either through housing or now due to COVID, we do everything within small space, to a citywide context. It really requires a wide range of engagement and collaboration to inform and advocate for policy change, behavior change, and several things. So now looking at our partners here from Saint-Gobain and Multiplex, who both have been long-standing partners and supporters in the WorldGBC, especially when it comes to the health and well-being agenda and the Better Places for People project. So it's good to look at their feedback from private sector perspective into this agenda. Why are they focusing on or supporting this agenda? So I will start with Pascal. So how can the narrative of health can be used at a policy level? How can we use it as a driver to catalyze change, to reverse the interconnected environmental and well-being damage? So connecting the dots, if we call it so. You're muted, Pascal. Yeah, if you can unmute yourself, yes.
Yeah, actually, as you say, connecting the dots, I think this is very important. And actually, the COVID pandemic has been, unfortunately, an opportunity to connect the dots between the environmental issues and the health issues, especially for the built environment. So we know the impact of buildings on the environment and health. It has been reminded just by the previous speaker. And we know also the impacts of buildings on resources and biodiversity. So the fast growing consumption of resources leads to the destruction of natural habitat and expose the humankind to new kinds of risk, and especially health risks. We know also that the contribution of outdoor, that heating and cooling has a huge contribution to outdoor air pollution. So renewable energies, but also energy efficiency measures, especially through the improvement of the building envelope, will deliver better indoor environments. And this is absolutely key. And there again, the measures which were taken in many countries to preserve people from the COVID have shown how important it is to live in healthy and comfortable places. The cost of poor indoor environment in terms of health impacts is huge, and I think it starts to be better known, especially by policymakers. Less indoor pollution and pollutants, less mold, less carbon dioxide, less noise, better light, more natural light, better thermal comfort. This will lead to less disease and healthier population. Thus, it will help decrease the expense for health, for keeping people healthy. And health is more and more understood as a major co-benefit of policy measures to protect the environment and of increased mandatory requirements for greener buildings. So I think that's taking those societal benefits into account will clearly support policymakers to make better decisions and increase the focus on energy efficiency and circularity measures in the built environment. And this is actually what we as a group are pushing for, trying to raise awareness of policymakers on the benefits and costs of health and environmental measures in the built environment.
Great, perfect. And the connection with economics as well, as you mentioned, is important as a driver, and how to measure even the economics of health and well-being, how we should value properly the value of health and well-being and environment. So moving to Jessica, and building up on the previous discussion. So the framework calls for social value, and we mentioned that we have a core principle when it comes to social value. And this social value actually cascades through the whole supply chain, not just from a design construction perspective, but throughout. So what do you think is the role of the policy here at a city or national level? And starting with, as we were discussing before the session, why is social value of importance to the built environment? Why should we value social value? Why should we put it there?
Yeah, thanks, Hamoda. In terms of policy, I think policy is only one part of the pie in order to create the right incentive structures for businesses to align to. But there's a whole bunch of work already happening with really key industry members like the World Building Council, but also the Building Responsibly Principles, the United Nations Guiding Principles on Human Rights. We've got the IOSH Code of Conduct that really enshrines that duty of care to protect all human welfare, but specifically workers, more vulnerable workers that we know due to COVID have been at the helm of many poor policy decisions.
Yes.
And I think it's really critical to note that the construction sector actually employs 7% of the global workforce, and we know that in the Middle East those figures are a lot higher. And so for us as social scientists, really focusing on the inclusion of worker rights, human rights, via participation, inclusion, to ensure that no one is left behind as we have these COVID Build Back Better plans, and the IMF has just launched their Fairer, Greener, Smarter initiative, but we know the EU as well, and many other institutes are working on those Build Back Better plans, is to make sure that when we are thinking about the design and construction of infrastructure, but also buildings, that we are taking into consideration demographic equity. We are looking at buildings that are designed for accessibility, for disabilities, making sure, just touching on what Nathalie said around access to adequate housing and affordable housing. We know it's not good enough just to build buildings that are empty and don't serve the communities that they intend to. And then thinking about things like access to light with mental health and green spaces that truly reflect a huge broad range of stakeholders. And then I think most critically where my work has been focused on is around migrant workers, construction workers. And it's formidable to think that many of the standards and frameworks that get launched don't include some of the key stakeholders, which are workers that build these buildings. And when we think about building responsibly and we think about wage payment, employment contracts, mental health, all of these things have huge synergies to living and actualizing self-dignity and human dignity in the social space. But I critically think when we're thinking about policy, that's one chunk of the pie. But then it's to think about at a corporate level or a business level, what management systems are being implemented to tackle these systemic issues around health, around accessibility, around inclusion, and how can you provide access to remedy? And this really means going beyond to deliver that public value right via risk mapping, procurement incentives, due diligence, like interviews, grievance mechanisms, training and capacity building. And I think until that kind of the health gap is bridged and married with some of these existing frameworks in a logical way, in a way that businesses understand, we then will be able to marry the policy and business approach.
True. And it's something that reflecting in our region, we depends on policies and government to drive change. Unfortunately, that's part of the dynamics in the region, that it's always government first, or yes, there'll be lots of lobbying, but unless you see a policy in place, it wouldn't be, I would say, for the mass market or for everyone unless there's a policy in place. You would always have early adopters, people lobbying for the start, but to generate a mass adoption, it has to be a policy. You need a policy to start it and to frame it as well. So going back to Nathalie, so looking at the wider context of urban health or connecting the urbanism and health, and reflecting and putting in our mind the current pandemic and what we learn from it, are you expecting a longer term shift toward healthy behavior? We have seen some changes during, protecting ourselves from the COVID or the spread of it. But do you see any long-term changes that will promote healthy behavior? And it would be great if you have seen some examples already in place.
And actually my response to this will build on what was just said by Jeff, because certainly the COVID pandemic has been very demanding for cities, but also for their populations, including the demands to change their behaviors. And it's almost a cliche, I would say, to say that cities have been at the front line of the pandemic and of urban dwellers, but the real fact is that they have, right? And the majority of COVID-19 outbreaks have been in cities for several reasons, including higher population and mobility. So city leaders have been under enormous amount of pressure from national governments and their own citizens to ensure that they could protect health during the pandemic. And citizens in turns, right, were asked to comply with a lot of behaviors. So this means that ensuring the right policies are in place of transmission, so like social distances and masks, etc., but also working with communities to ensure that those behaviors are actually being followed safely. So all this made it, quite complicated, but we have very good examples, like in Kampala, for example, in Uganda, where COVID-19 vulnerability indexes were built to understand which areas of the city were most in need of support, but also how to involve the communities within that process, or having like cities like Freetown in Sierra Leone or Milan that have introduced emergency food programs, for example. Now, as was said before, city leaders definitely don't think only about the immediate response, but also about sectoral choices that they will have to impact in future, right, on the outbreak preparedness and response. So the key strategic decisions that are made in strategic sectors like housing, urban, land use planning, agriculture, and you name it, but also education and services are essential. And working closely with the other sectors is actually a key strategy to deliver health through urban interventions. And for instance, just to go back to the examples highlighted before about housing, they are essential to reduce the health burden due to unsafe and substandard housing conditions, in particular in this COVID time. Now, just going back to the question about behaviors, about long-standing changes, I think the major point that I want to make here is that certainly we will see a change in behavior, and that populations have been, better understanding what does it take to stop. But at the same time, we can't expect having changes in behavior if the environment in which people live is not adapted to it. So we need to have a better strategic integration of health-related actions in urban planning in order to make them people able actually to change their ways of life and behavior. So that's just in conclusion, the main point I want to make. Behavior change can only happen if there is a supportive environment to operate in.
If there's a supportive infrastructure to maintain it for long term. Because building on what you and Jesse alluded before, from even if we have the policy, it's not enough to sustain long-term adoption and buy-in, because a rule in its own is not enough if you don't have people to follow it and to accept it. And from an infrastructure perspective, if I want to promote something as walkability, for instance, it's not enough to have just a pavement in the road if you don't consider shading and comfort and the quality of the space that can actually make people willing to walk. So it's not just providing one piece of the equation and ignoring the other. So building on this, the quality of the space, and this will be to Pascal. I mean, we know Saint-Gobain have lots of experience in indoor environmental quality research, and you recently concluded a great study on indoor air quality with schools in the Emirates in collaboration with the WorldGBC. Can you share some findings and some insight on this research and how this can inform or code actions from a policy perspective for wider adoption?
Yes, sure. Yeah, actually, as you said, beginning of this month, Saint-Gobain, together with the Emirates GBC, published the findings of a study on indoor air quality that was made in a representative school in the UAE. The report is called Making UAE Schools Healthy, In-Depth Measurement of Indoor Air Quality. And this is a report which actually highlights the need to improve schools' indoor environments by taking into consideration not only the indoor air quality, but also other factors such as lighting, acoustics, and thermal comfort. The study is part of the ongoing activities of the Emirates Coalition for Green Schools, which actually promotes discussions to create a national vision on healthy and high-performance schools to allow students to have better learning conditions. The study actually covered a very comprehensive audit of the indoor air quality conditions in the school, and it was made through continuous monitoring and with some air sampling. One of the main findings that we got from the study is that the limit values set by the government authorities for temperature, for humidity, and for carbon dioxide are far from being met in the different classrooms measured. And this has an impact, a negative impact on the capacity of children to learn. And we identified also in this study that there were some volatile organic compounds that were identified coming from the cleaning products, which shouldn't be there, which are actually hazardous and especially for children. Measurements we did regarding acoustics and regarding light also showed that there was a need for improvement to enhance the well-being and the comfort for all occupants and to improve the learning abilities of students. So this report concluded with 7 recommendations, such as the need to increase the outdoor air rate of the building, and to comply with standards such as HRA or REVA standards, to also improve, to reduce the percentage of indoor air circulation and to increase the percentage of fresh air into the building, to maintain the humidity level with an acceptable range, both for thermal comfort and to prevent mold. There was also a recommendation regarding cleaning products, go for cleaning products, fragrance-free and possibly eco-labels. Also to include some acoustic measures such as acoustic ceilings or ventilation and air conditioning ducts that would improve also the acoustics. So all kinds of measures that are easy to implement and that will deliver quick results on the children. And in parallel to this report, there was a call to action to the different stakeholders, to the government authorities and policymakers, to the schools and school facility managers, to the designers, to the consultants, to the NGOs and research institutes, and of course, to the manufacturers and suppliers. And I think it's very important that such research will help to improve the discussion and the level of knowledge of all stakeholders, because what we need in the end is to have an holistic approach to this indoor air quality topic.
Yeah, perfect. And what I like as well, that these recommendations are scalable, so the quality of the classroom is very close to what we should look at housing or office spaces or similar. The quality of the space itself is key, and unfortunately some of the I would say the practices that people think the priority should be for improving energy efficiency. So we increase the energy efficiency by minimizing the air exchange just to keep the equipment running better, which is not the right things to do anyway. So unfortunately, some people think to be more sustainable, you need to do it over our health and comfort. And I'm glad that these kind of research and studies and many more show actually the opposite, that no, we can actually achieve both. So speaking of maintaining the topic of quality, and going back to Jessica, and you mentioned workers' accommodation and worker spaces, and typically people overlook their needs and the spaces. So from a multiplex perspective, as a big contractor, you have been doing driving lots of industry attention to the pressing issues of human rights in the construction industry. Can you please share with us more, how are you approaching this topic as a contractor working in different countries across the region?
Yeah, so I actually started my career in the Middle East, out in the field, running labour camp as one of 9 females with 4,500 migrant workers under my control. And I can tell you one thing, some of the learnings that we grafted with and we had to deal with were humongous. And my absolute passion in this area is, how do we look at human rights that are most tangible, most material to your business, and even identifying those for you would be very different to a main contractor versus a consultant. But to answer the question, I think as stewards of the built environment, we often try to shape the things that we see, but without being cognizant of the vulnerabilities that buildings might actually create through building them, but then also once they are built, some of the income inequalities. We know that with Brazil and the favelas, and we know that as well. Some buildings have huge impact in terms of the entire health of communities and those that build them. But our human rights approach has been very much focused on workers' rights and welfare, really focusing on worker grievances, remedy around wage payment, around recruitment practices, and really trying to work to ensure that working conditions are safe, and that the building responsibility principles are implemented. So for an example, we implemented one of the first ethical recruitment management systems in the UAE, really focusing on Nepali workers. 70 workers were recruited debt-free. So you can imagine the mental saturation of being in poverty once you arrive into a country, and then some of those exacerbating vulnerabilities right at the front end. And some of the most recent issues that we've been working on are drawing on the socio-environmental human rights types of topics. And this really is looking at migrant workers, predominantly in the UAE, are coming from Southeast Asia. We know that our workforce in particular, 54% of them are from Kerala alone. And climate change and heat stress and heat temperature rises are having disproportionate impact on workers that are building buildings. So we've been really focusing on the impact of temperature on health. And just last year, we engaged a human rights consultant to really deep dive into some of our processes and procedures, and to see how some of these heat stress risks that we think are, climate change related, everyone's focused on the climate aspect, but these have serious health consequences for those, particularly that are building buildings. And so we invested in TWL machines to generate 10,400 data points to really steer our risk assessment controls and activity. And then once we started reporting that data, we figured out that in 2019, the average temperatures from 2018 had risen by about 10 degrees. And so we were dealing with temperatures that are a lot higher with saturation levels in terms of humidity really playing out. And so we were able to then implement a whole bunch of stuff around hydration stations, fans, rest work schedules, and using that trend analysis to steer specific, not just building responses, but floor responses, etc. So that in 2019, as a result, we were able to reduce heat stress cases by 52%. So what started off as a climate issue quickly turned into a human rights, social equity issue that's now the social production of risk in terms of health and well-being started to become more of a focus. And then when you look at that in terms of remittances and and financial inclusion, the multiplier effect of the health on the families that are on the recipient end are humongous. So yes, we those are the two key areas that we've been focusing on. More recently, just to wrap up here, we've been looking at some of the cases around health in our sector, in particular around work-related stress, depression, anxiety. There's over 400,000 working days that are lost each year alone due to anxiety and stress. And so more recently, we've been looking at flexible working and the ability to participate in the workforce and from a gender space, but also looking at it from a chronic stress and fatigue space, to really create a solution that marries both those two concepts together.
Perfect. And it will be good to see if these data are available to be shared, it will be good to see how others can make use of them to drive their own policies and practices through the region. So we are almost to the end. So I would like to go back to the rest of you too. So if you go to the health and well-being framework that we explained at the start, I would like to hear your opinions. What do you think is the next step in evolving the principles and information to be relevant for city, community, and regional level? So how to scale up these efforts in the health and well-being agenda, or taking it from building scale to a wider regional, city, community, and regional scale. And I will start with Nathalie.
Thanks a lot. And again, if you allow me, I would like to maybe take a bit of a broader view on that beyond the health and well-being framework, but in general, right? Yes. This health and urban approach. And I think, again, stressing what was being said, COVID-19 has highlighted really the importance, of working together and the role that other sectors play, but also the collaboration cities with other cities and leaders with local communities. And certainly, again, a question that was raised is we face now how these kinds of temporary changes in infrastructure can actually become more permanent, right, and deliver long-term benefits for the population. And I think one crucial element is certainly that the allocation of investments and the policy decisions will need to guide both the short and the long-term recovery. But I would like to highlight one specific entry point coming from, World Health Organization and having the health sector as our counterpart. Again, whilst recognizing that the responsibility for many of those policies is actually within other sectors outside health, the health sector has really a key role to play in providing the health evidence, for example, both as regards on the health risks, but also on the health impacts of the policy changes. So there is a need of having the health sector playing also a fundamental role in building health competencies for all those that are involved in this policy making process at the local level, but also including the health sector. And having also working and building on an increased health communication. So as we move ahead, I think that the health sector needs to really further support the policy-making process at the very local level in providing the evidence, but also effective responses, but also estimating, for example, the health impacts of, just again, to go to the housing example, the burden of inadequate housing conditions, and to work towards developing recommendations and tools. And lastly, I think that also, again, the health sector needs to recognize the value of what we call the non-health data. So we are not talking only about health outcomes, but we're calling about determinants. So data on exposure of air pollution, or data about populations that is relying on primary reliance on clean fuels needs to be seen as a health, information. So again, capacity building, I think, needs to be really enforced. And again, not only for other sectors, but for the health sector itself. We need to have our own people, our own crowd being better understanding about the impact of the urban, the sector's impact on health.
Yeah.
So in concluding all this, strengthening communication also, health communication, but I think targeting also specific communities is essential.
Perfect. Pascal? You're muted, I guess.
No, yeah. Well, I think first we need to take a life cycle approach when it comes to the cost. So not just to consider the cost at construction stage, but to have a broader view, life cycle based, that will not only include environmental costs, but also societal costs, and in particular those health costs. Second, I think it's very key to develop local ecosystems to make sure that we are able to develop common visions between the different stakeholders at local or regional level. A shared vision about the challenges and a shared vision about the solutions. And there it goes beyond only communication. There is a huge role to be played by education of all professionals. The next point for me, which is very important, is to make sure that local authorities will play a leading role for piloting the implementation of the framework. And in particular, that many requirements that are in this health and well-being framework will be translated into requirements for public procurement. Yeah. And in particular, any kind of a public building should be taken as a pilot project to demonstrate feasibility and benefits in terms of health of greener buildings. And last but not least, I think we need to make sure that regulations, federal regulations, national regulations will progressively and possibly as soon as possible start to integrate more requirements regarding health and well-being. Today, it's too much focused on environmental aspects like carbon or waste. We need also to include the health dimension. As you said before, there shouldn't be trade-offs between health on one side and environment on the other. This has to go hand in hand. And this needs to be translated also into legislation.
Perfect. Jessica, because I see Dominica's here, so I need to...
Yeah. So yeah, I just echo exactly what Pascal said as well around the regulation environment. But I think one key thing as well is making sure that we're holding rating agencies for buildings, rating standards, BREEAM, LEED, WELL, Estadama, that they are also starting to see some of those synergies between social equity, health, well-being, and are bringing those key tenets of vulnerability into those rating systems. Yeah. I'd also say that as clients and tenders and the investor community starts to become more aware of these synergies, we need them to take a lead in their contract Most companies respond to their contractual requirements. So again, starting from the top is really essential there. I think at a regional level, just to echo what Nathalie said, I do think that education and dialogue and discussion is important, but I think it's got to be greater than that as well. And looking at a business level, we've got to develop those leadership competencies. You know, as sustainability professionals, we've got this language, we've got this understanding, but how are we building the competency, the knowledge gap that some of the leaders that might be influencing change within our sector, they're equipped to deal with the next round of complexity around health, well-being, construction, engineering, and merging those themes together. One last thing I'd say is that at community level, we need companies to lead by example. It's not just the regulations that should be driving us. We should be really leading by example, sharing best practices and amplifying the messages around health, well-being, climate change, climate justice, social equity, and really using the power of our influence as multi-billion dollar companies to really implement that human element into the decisions that get made by very, very powerful institutions. So again, we shouldn't forget the power of our power as consumers of product, but also as property owners, as people that select materials, etc. So.
Thank you, and I would like to thank all the speakers. As we wrap up, I think from a Green Building Council perspective, the framework has offered a good opportunity to how to move things into practicality, how to take the framework into practical examples, case studies, capacity building, how to change the mindset for the whole stakeholders. So speaking from a client, from a government, from an expert, how to integrate health in all topics, what we call the health in all topics, how health can be a key component in driving our discussion and even evaluating our choices and making sure that did we study the health impact or not. So it's not just looking at the environmental impact and climate action, but it's key to drive the discussion hand in hand. With that, I would like to thank you all for taking part, for your insight. Apologies if we didn't get the time to go for the question. There are lots of good questions in there, but I hope we can get back to them after the session. And Domenica, back to you.
Thank you so much, Hamoda, and thank you to all the panelists. It's been amazing to see the evolution of the health and well-being agenda in the built environment on the global level, from being something that was considered a co-benefit back in 2013 in our business case report to now a critical value component in our upcoming Beyond the Business Case report. And also from a topic that touches on the occupants of buildings to one that actually includes the health and well-being of all the people involved across the supply chain. So thank you for this wonderful discussion to all of you. I now invite everybody to join our next session, Building for Health, How Can Buildings Protect Us? So to access this session, click the sessions icon to the left, and I will see you there.